Hi, good night, everyone. This is Nikki checking in. I hope everyone's having a great week so far. So, I just wanted to jump on as promised. I wanted to talk about postmenopausal bleeding in women on HRT therapy and management. So, the recommendations that I'm going to be speaking about are recommendations from the British Menopause Society. But first, before I get into it, I wanted to let you know that my makeup. I am doing a combination. My eyes are from a Sephora palette known as Sephora Pro. I've had it for maybe 4 or 5 years. Colors are so vibrant. So the colors that I have in my eyes, the look is called Cyrene, and it is the color Coven is that green on my eyes, and I think it really highlighted the green that's coming off my shirt. And this is a simple Gap shirt that I have had for a while. So when it comes on to my look and my clothes, I shop, but I tend to shop for things that I need because I used to be a chronic shopaholic, like most women. And I tend to now shop based on the things that I need that are going to add value that I need in my collection. I shop randomly too, but if I'm going to pick up something, an item, it has to make sense, because we spend and we shop and we buy accumulate all these things, and they don't we don't need them, and we end up not using them, and they become a monument in our closet or in our homes. Anyway, so I just wanted to tell you about the eyeshadow palette, which I really like, this color Coven from the Sephora Pro collection that I bought approximately 5 years ago in 2019, I think it was. Now, let's get back into women vaginal spotting or bleeding and management of that with women who are on HRT and they're postmenopausal. So when you start HRT, and you sequentially go up on the dose of the estrogen component as well as a progesterone component, you may start to experience some vaginal spotting if you actually go up too high. So each woman's body is a little different, and each woman's tolerance to the estradiol or the hormone, the external hormones that are being added to the body is different. Um, Postmenopausal bleeding in on the HRT therapy, don't be too alarmed. What your practitioner will do is they will go down on the dose to the next tear down, monitor for 2 weeks to see if the bleeding has stopped. Now, if you're a postmenopausal woman, whether or not you're on HRT, hormone replacement therapy or not, if you have vaginal spotting or vaginal bleeding, that's a cause for emergency. So I would recommend at that time, if the bleeding has not subsided in 2 weeks, to get a pelvic ultrasound. When you get that pelvic ultrasound, the endometrial lining, which is the inner part of the uterus, that lining in a postmenopausal woman, in a woman who is on an estradiol patch that is changed twice weekly, the lining of that inner lining of that uterus should be no greater than 4 millimeters. If it's greater than 4 millimeters, then that is cause to concern. That means there's still some building happening with the endometrial lining. That is because estrogen is a builder. It causes hyperplasia, overgrowth of cells. We don't want that. Now, if you are, that is why it is super important when you're on that hormone replacement therapy, you are to take your nightly progesterone. You have to. Don't forget, because progesterone balances the estrogen and prevents that building of the inner lining of the uterus. Now, there is another way that hormone replacement therapy is prescribed, usually in women who are between 40 and 45 and 50. This is a may prescribe this. I don't prescribe that way because it's a really I don't like the fact that I'm not a fan of it, I should say, but it's called sequential hormone replacement therapy. And what that means is that you're going to be cycling between the two hormones of estrogen and progesterone. So the first part of the cycle for 12 days, you take estradiol pill, which is that estrogen component of the HRT. And then on the latter part of the month, you take progesterone pills. Now, in that way, it sort of mimics that sort of slope of where you go up and down in hormones, where it mimics a menstrual cycle, where at the beginning of the cycle, estrogen goes up. At the end of the cycle, progesterone increases and estrogen drops. Now, that's what it's mimicking. Now, if you're having vaginal bleeding or vaginal spotting and you're on a sequential hormone replacement therapy, which is, cycling first half of the month you're on estrogen, the second half of the month you're on progesterone. Then, and you do that pelvic ultrasound, the lining of the uterus should be no less than 7 millimeters. Okay, because the lining builds up and it goes down, okay, because of how you're cycling with the hormones. If it's greater than that, it's cause for concern. So the next step would be we'll scale back on the hormone replacement therapy, and then an endometrial biopsy is recommended, or hysteroscopy, which is where they go inside and they look at the inner lining of the uterus and they take a sample of it. Now, if you're having a little bit of vaginal spotting and you've just started the hormone replacement therapy, please not worry. Talk to your provider. You should not be bleeding, so we have to roll back on the estrogen, which means that your body is not, tolerating the hormone replacement therapy at that dose. A therapeutic dose for a lot of women. A lot of women, if you go to the 1 milligram patch twice weekly, you really have minimization of symptoms, but roll back a little bit to the 0.075 or the next tier down, which is 0.05 milligrams, next tier down 0.075 milligrams, and so forth. Now, I'm going to talk some more about the actual recommendations, how we manage it, based on the British Menopause Society. But I just want to do an intro, and that's going to be my next topic on my next reel. Have a nice day, and thanks for listening. This is Nikki, your menopause specialist, a nurse practitioner for Midlife Synergy. Take care and have a good one. Bye.